What steps do you need to take for the upcoming Medicare AEP to prepare yourself for Medicare in 2026? Medicare AEP runs from October 15th to December 7th. That is the time of year where you can make changes for the next calendar year. I want to remind you of this though. If you are not yet on Medicare, this period of time has nothing to do with you. This is a period of time where people already on Medicare can make changes with their coverage for the next calendar year, starting January 1, 2026. One caveat to what I just said, for those of you who just started Medicare, maybe in the second half of 2025, that period of time does apply to you. So make sure you take steps during that period as well. So what are the steps? Let's go through them. First, when it comes to Medicare Part A and Medicare Part B, there is nothing you have to do. You're already enrolled in it. You're paying your monthly premium for Part B. Nothing to change, nothing to do. If you're in a Medicare supplement policy because you have stuck with original Medicare, remember, you can change your Medicare supplement policy any time of year as long as you can qualify with your health. Yes, there are some states with birthday rules or where they don't ask health questions, but as a general rule, to switch supplements, you must qualify. And again, you're not limited to that October 15th to December 7th. It is based on when you get the increase and you determine if there are better options out there for you. Now let's get to what you do want to consider doing. First, if you're in original Medicare and you have a Medicare Part D plan, so prescription drug coverage, you should get that annual notice of change. It's going to come in the mail. You should probably have it by now. You're going to learn whether or not your premium's going up, how the plan is changing. So you're going to want to make sure it's still the most cost-effective plan for you in 2026. Your time of year to do it is from October 15th to December 7th. If you do nothing, you will remain in the plan you're in, unless, of course, you receive notice that your plan is being canceled. If that's the case, or merged into another plan, you definitely want to look into figuring out what's going to be the right plan for you for the next year. Then you also, if you are in a Medicare Advantage plan, this is the time of year for you to make changes for the next calendar year. So you will have another opportunity in the beginning of 2026, but this is your first chance. You're in a plan. Look to see, are your doctors still in network? How are the co-pays, the MOOP, the co-insurance? Are your drugs covered cost effectively? How are the perks? This is the time of year to look and try to select a new plan if your old plan no longer fits your need. Also watch, there are some plans that are going to be canceled for 2026. Look to see, is your plan going to continue? If you do nothing, you'll remain in your plan, but you may need to take some action, whether it's been canceled or whether the plan no longer suits your needs. This is also the time of year where if you're in original Medicare and you want to go to Medicare Advantage, you can make that switch, or vice versa. If you're in a Medicare Advantage plan and you want to go to original Medicare, you can make that switch. But if you're going to go from original Medicare to Medicare Advantage by enrolling in a Medicare Advantage plan, that will take you out of your Part D plan for January 1st. But remember, if you have a supplement, you're going to have to take steps to leave that plan. In the reverse, if you are in a Medicare Advantage plan and you decide you want to return to original Medicare, there's some important things to be thinking about. First, by enrolling in a Part D plan, that's going to help disenroll you from your Advantage plan. So you'd have to look at the Part D offerings in your zip code. But the big thing you have to think about is if you're leaving a Medicare Advantage plan, can you qualify to get a Medicare supplement policy? And in this scenario, if that's your fact pattern, you do need to apply for that supplement during that time to make sure that it is a good decision to leave your Advantage plan. Because if you have chronic health issues or you're in the middle of some sort of health crisis, you may not be able to get that supplement and it may not be a good decision to leave. So make sure you do your research, talk to whoever's advising you, reach out to me if I'm licensed in your state, and just make sure you take action.